Hello dear students, welcome back to my channel. I love pharmacology. In today's session, let us learn about drugs used for treatment of asthma. So this is the disclaimer. So coming to the first group of drugs. So here we have Albuterol, which is a beta-2 agonist, which is a short-acting beta-2 agonist, which on stimulation of beta-2 receptors in the lung, it causes bronchodilation. Next, we have a Salmeterol, which is a beta-2 agonist, but it is a longer acting one. It acts on the beta-2 receptor present in the bronchial smooth muscles, leading to bronchodilation. So albuterol is a shorter acting beta-2 agonist, whereas salmeterol is a longer acting beta-2 agonist. Next, we have a Chromoline Sodium. So Chromoline Sodium is a mast cell stabilizer which helps in prevention of release of histamine and other pro-inflammatory substances. So Chromoline Sodium is a mast cell stabilizer which prevents the release of histamine and pro-inflammatory mediators. So next we have a Hypertropium Bromide or Theotropium Bromide, which is a anticholinergic agent. So these drugs are very short acting in nature. So they helps in inhibition of the bronchoconstriction mediated by M3 receptors. So hypertropium or thiotropium bromide is a shorter acting anticholinergic agent which inhibits the bronchoconstriction by blocking the M3 receptors in the bronchial smooth muscles. So next we have a Montelukast or Zelutone. So this Montelukast is a leukotriene receptor antagonist. So they helps in inhibiting the activity of pro-inflammatory leukotrienes. So Montelukast is a leukotriene receptor antagonist which inhibits the activity of pro-inflammatory leukotrienes. So basically they inhibit the action of leukotrienes mediated inflammation. So next we have a Zelutone, which is a 5-lipoxygenase inhibitor. So Zelutone is a 5-lipoxygenase inhibitor. Basically, it inhibits the synthesis of leukotrienes. Please remember, Zelutone and the Montelukast were the leukotriene receptor antagonist, whereas Zelutone is a 5-lipoxygenase inhibitor, which inhibits the synthesis of leukotrienes. So next we have a beclomethasone, fluticasone. So both are glucocorticoids and they help in anti-inflammatory activity. So they cause anti-inflammation by inhibiting various pro-inflammatory mediators. So basically, glucocorticoids like beclomethasone and fluticasone will provide anti-inflammatory action. So to summarize, albuterol is a shorter acting beta-2 agonist, whereas salmeterol is a longer acting beta-2 agonist that helps in bronchodilation. Whereas Chromoline Sodium is a mast cell stabilizer which prevents the release of histamine, along with they also prevents the release of pro-inflammatory substances. So next we have a Hypertropium Bromide, which is a shorter acting anticholinergic agent which inhibits the bronchoconstriction by inhibiting M3 activity in the bronchial smooth muscle. Then we have a Montelukast and Zelutone. Those are the leukotriene receptor antagonists. Basically, they inhibit the activity of leukotriene mediated inflammation. Then we have a Zelutone, which is a 5-lipoxygenase inhibitor. So this inhibits the synthesis of leukotrienes. So next group of drugs are beclomethasone and fluticasone, which are the glucocorticoids. Basically, they have the anti-inflammatory action. So they mainly prevents the pro-inflammatory mediated actions. So thank you. If you find this video useful, please do subscribe to my channel. I love pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. And also, if you want to support this channel, kindly click on the super thanks button. Thank you.